we have an important topic, that is the cardiac cycle. Cardiac cycle actually that occurs in a one heartbeat. We have the two atria and we have the two ventricles of the heart. This is called here beta. This is called here right atrium of heart, right atrium, and this is called right ventricle of heart. Our heart has four important chambers. One is the right atrium, right ventricle. This is here left atrium. This is here left atrium of heart, and this is here left ventricle of heart. So how can we define the cardiac cycle? The cardiac cycle, in the cardiac cycle, all the chambers of heart, they show the contraction and relaxation. But we know the right atrium and left atrium shows contraction and relaxation, systole, diastole simultaneously. Similarly, the right ventricle and left ventricle, they work together, they work jointly and show systole and diastole together. So all these events, so the heart, auricles of the heart and ventricles of the heart shows contraction, systole and diastole, and these two events constitute the cardiac cycle. So in simple words, we can simply say all the events, all the series of events that occurs in one heartbeat, you can call that cardiac cycle. So here we can say the series of events which occurs in one heartbeat, that is called a cardiac cycle. So you have to remember beta, cardiac cycle में होता क्या है? So the both auricles shows systole and diastole, both the ventricles shows systole and diastole. All together constitutes the one heartbeat, one cardiac cycle. So we have to also remember, जो ये systole और diastole जो auricles, atria और ventricles show करते हैं बेटा, जो one heartbeat of heart gets completed in 0.8 seconds. So we know simply at this rate our heart shows near about 70 to 72 heartbeats in 1 minute. So rate of heartbeat is beta 70 to 72 heartbeats per minute. So if we simply explain the concept of cardiac cycle, the cardiac cycle gets completed in three important steps. One important step of cardiac cycle is beta, you call that atrial systole. Okay, beta, atrial systole. And second step of cardiac cycle is ventricular systole. And third important step is we call joint diastole. The joint diastole is also commonly called a common path of heart. So cardiac cycle has three important steps for the completion. One is atrial systole, one is ventricular systole, and one we call a joint diastole of heart. So let us define first of all what is atrial systole. So atrial systole, in the atrial systole of the cardiac cycle, what will happen there? The first part of the cardiac cycle is beta atrial systole. Auricular systole भी कह सकते हैं आप, atrial systole. We have to remember the systole means contraction. Systole means contraction and diastole means relaxation. So this is the right atrium here, RA, right atrium of heart. So in the atrial systole, what will happen? So right atrium as well as the left atrium shows contraction. These two chambers of the heart shows contraction simultaneously. So atrial systole occurs. This atrial systole, auricular contraction. This atrial systole occurs for 0.1 second. So 0.1 second, both the right and left atria shows contraction. And atrial diastole occurs. About 0.7 seconds. So during atrial systole, what will happen? The right atria and left atria shows contraction. The blood of the right atria enters into the right ventricle of heart through an aperture we do better, that's called RAVA, right auriculoventricular aperture, and the blood of the left atrium enters into the left ventricle through an aperture we call LAVA, left auriculoventricular aperture. So when right atrium and the left atrium shows contraction, here the tricuspid valve opens, and here the bicuspid valve gets open. So the blood of right atrium enters the right ventricle, and blood of left atrium enters left ventricle of heart. We also know that the right ventricle में कौन सा blood होता है बेटा? इसमें होता है deoxygenated blood. So the deoxygenated blood of right atrium enters the right ventricle, and left atrium contains oxygenated blood. The oxygenated blood of left atrium enters the right ventricle of heart. Now this occurs for 0.1 second. Later on, what will happen? When the one more part of the cardiac cycle, you call that part is called a ventricular systole. That's called a ventricular systole. The ventricular systole of heart occurs for 0.3 seconds. So this ventricular systole occurs 0.3 seconds. And ventricular जो diastole होता है, ventricular diastole, that occurs about 0.5 seconds. What will happen during the ventricular systole? So we know better, right ventricle, when it pumps the deoxygenated blood that goes to the lungs through by an important blood vessel. That blood vessel you call the pulmonary aorta. From the right ventricle of heart, there arises a very important blood vessel that's called PA, pulmonary aorta. So when the right ventricle, this is the right ventricle here beta, this is the right ventricle. When right ventricle pumps shows the systole, the deoxygenated blood goes to this vein, through this vein that's called pulmonary aorta, it goes to the lungs for oxygenation. And simultaneously, when left ventricle pumps the blood from the left ventricle, we know better, from the left ventricle there is a big blood vessel, we call that dorsal aorta, also you can call that systemic aorta. So we have to remember, when the right ventricle and left ventricle shows contraction, shows systole jointly, simultaneously, the blood, the deoxygenated blood जो होता है right ventricle में, that go to the lungs for the purification, for the oxygenation. And the blood of the left ventricle, that's oxygenated blood, when left ventricle shows a contraction, the blood of left ventricle goes to all the parts of the body that carries the oxygen. So ventricular systole occurs 0.3 seconds. During ventricular systole, the blood of right ventricle goes to the lungs for oxygenation, and the blood of the left ventricle goes to the all body parts, that is oxygenated blood. So we have one more part of the cardiac cycle beta. That part of cardiac cycle you call that's called the joint diastole. That's called joint diastole of the heart. There's a third part of the cardiac cycle. The third part is we call joint diastole. Joint diastole of heart is also commonly called common path of heart. Common path of heart. What is it? This joint diastole occurs for 0.4 seconds. 0.4 seconds में joint diastole होता है क्या है बेटा? इसमें जो right atrium है, left atrium है, right ventricle है, ये left ventricle है, इस joint diastole में all the four chambers shows relaxation. Just diastole, relaxation. When all the four chambers, right atria, left atrium, right ventricle and left ventricle, when they are in the relaxation, in the diastole period, all the four chambers are in the diastolic period, you can call that joint systole. All the four chambers of the heart are at relax. So all the four chambers of the heart, are at relaxation period. Of heart are at relaxation period or at relax. You can call that betterly diastolic period. But remember one important thing which we have to note here, when all the four chambers of the heart are at a relaxation period, you have to remember this tricuspid valve, this is a tricuspid valve, and here is a bicuspid valve. So here is a left auriculoventricular aperture. It is guarded by bicuspid valve or mitral valve. Here is a right auriculoventricular aperture. It is guarded by tricuspid valve, tricuspid valve. So when all the four chambers of the heart are at relaxation, the blood which comes from the great veins like inferior vena cava, that brings the deoxygenated blood into the right atrium, and we have one more blood vessel here that that carries the blood, that brings the blood from upper parts of body. What is that? That is called superior vena cava. All the blood from the great venous, the blood from the great venous, this is superior vena cava, yeah? That brings the blood from the upper parts of the body, but deoxygenated blood is that enters the right atrium. This is right atrium here. So blood from the great venous that goes directly into the right ventricle of the heart. 75% blood, 75% blood that carries by great venous, superior vena cava, inferior vena cava, that directly enters into the right ventricle via through the auriculars. So similarly here, the blood from the pulmonary venous we know better, that carries the oxygenated blood, PV, pulmonary venous, which carries oxygenated blood from the lungs into the left atrium, that directly enters into the left ventricle of heart through LAV, left auricular ventricular aperture. So the blood from the great venous directly enters into respective ventriculars through the respective atria. So near about 75% blood enters directly into the respective ventriculars from this great venous, superior vena cava, inferior vena cava, pulmonary venous, that directly enters into the respective ventriculars during the joint diastole. Because during the joint diastole, all the four chambers of the heart at relaxation period, at the time this tricuspid valve and bicuspid valve remains open. So blood enters directly into the this respective ventriculars via through the respective auriculars. We have to remember one more thing. During this cardiac cycle. What is that? When the ventricle of the heart shows contraction, we know better. When the ventricle of heart shows contraction, that is 0.3 seconds. But after that, there is the ventricular diastole that occurs for 0.5 seconds. During ventricular diastole, there is a very important point that we have to note. वो क्या बेटा, जब ventricular diastole करता है, so blood can come back through these arteries, through the pulmonary aorta into the respective ventricle, yeah, through dorsal aorta. So there can happen the backflow of blood. But we have to remember, during ventricular diastole, the backflow of blood into respective ventricles that can be prevented, because in the pulmonary aorta and the systemic aorta we have a valve, we call that semilunar valve. These semilunar valves, SL valves, semilunar valves, gets closer. Now one of these valves gets closer, so the backward flow into respective ventriculars, gets stopped. So we have the very important valve in the pulmonary aorta, that's called pulmonary valve, that is made up of the three semilunar valves. We have also in the dorsal aorta, also called a systemic aorta, we have also their valve, you can call it systemic valve. That systemic valve also gets closer during the ventricular diastole to prevent the backward flow of blood. So all these events, so when auricular work, atrium systole, contraction, diastole, ventricular contraction, and ventricular diastole, that gets completed in one heartbeat. That time is just 0.8 seconds. Thank you. Thank you very much.